hungry. I don't know, every time they put me before lunch, so I'll try to be quick. Okay. I will talk today about blockchain in healthcare. I've been here last year, actually was talking about it, and it was very brief. So some people attended my lecture last year who didn't, so we'll just give a brief about who we are. We are the free zone authority in Dubai, and we are specialized in healthcare. So basically, we operate in our own model. We license all the healthcare facilities, all activities in our determined zone. So we have a set of hospitals, clinics, and then, of course, we have other commercial arm to sustain our business. We are located in the heart of Dubai. We have two areas, phase 1 and phase 2. Phase 1 is basically in Oud Metha, and it is almost 89% completely filled. Phase 2 is being given to us almost 3 years ago, and we are working on this one now. The difference between two of them, phase 1 was only concentrated on providing healthcare facilities and clinics, but phase 2 is going to be like a city, so they have commercial aspects more in that one, like residential and maybe malls and so on. These are some of our partners who they have current regional or headquarter offices in Healthcare City. Now, the healthcare ecosystem today is basically different. We used to go to a doctor and see him, and then go to a pharmacy and take the medication, and then go talk to our friends to take more advice, and then follow the news, and then read the news and read the article. Today, no matter what technology is coming, is forcing us to work as a full systemized system that I need to have all services in one plate. So today we call it an ecosystem. What does ecosystem means in our terminology? That we need two things. We need the system to be fully automated and talking to each other, and we need the services available for the patient in one platform. Not forgetting that the healthcare professionals themselves, they need a place that they can work and teach and give their research and so on. So today, this is just a basic, quick one shot to show you how the healthcare system is really complicated, yes, but this is what is needed today to have a full city of healthcare. Why it's complicated? Why when you talk about blockchain and healthcare, it's really complicated? Because we have several challenges. Location, data. The moment you talk about data and location, they say about, like, for example, clouds. No, it's not allowed. Why? Because you are jeopardizing that you're putting the patient security information all in cloud, and it's going to be accessed by another certain external country or website. Then it comes legal. Then it comes the licensing and so on. So this sometimes makes the issue of securing the data should be always localized, and today this is not the case. The law has been very clear that we can utilize. Format of the data. You have patient medical records today is not only a simple file. In old days used to be a big file, the doctor will write all information, all other professionals will write all history in the same paper. Today you have a PACS system which is for the X-ray. It's totally separate. Then you have EHR, electronic health records, which is another separate system. Then you come with the physiotherapy department, they have their own system which has to utilize. Then you go to surgery, then you go to insurance model. So you have lots of complicated systems who are different models and different weight and not talking to each other. The definitions of the data itself, again, it is subjected to the source, which is codes. Patients' codes are different than disease codes. So if I want to diagnose, I used to write in the papers heart failure, or some of the jokes the doctor used to say heart stopped. But today you cannot say heart stopped. There is a code for any single disease. Data complexity, and we spoke about this one, regulations and requirements. Again, regulations. You have multiple countries and cities. They have different setups. Then when you want to license, for example, professional, you have to talk to that authority. Again, same thing. If you want to exchange the patient information between a clinic and a clinic, still you have to have the regulations and requirements for that exposure of information. So what is the potential of blockchain in healthcare? Actually, there is a great potential in healthcare. It's huge. It's not small. I was attending a conference in Armenia almost a week ago about blockchain. And they were talking about Bitcoin and the transference of Bitcoin and so on, and blockchain with it. It's actually massive projects has been carried out about blockchain and so on, how to transfer this data. So when you talk about healthcare, you talk about healthcare organizations to direct this information to blockchain. So I go to a hospital. First thing, I need to see my medical records or to take that medical records. The moment I log in or register my file, that information should be logged in into the blockchain. That's one thing. Transaction completed and modified. Now this transaction should be secure, all the data of the patient should be secured in blockchain. When it's secured, it's non-identifiable. Basically, you put the patient demographic information like age, gender, disease, and so on. You don't talk about his name or where does he live, married, and so on. No, you talk about demographic information. Then submit the direct query on blockchain. What do you want to do? How are you going to submit it to the blockchain? What transactions do you want for the patient or the doctor or the institution? Once you submit there is a created key for that. That key, which will share the identity of the patient, will be encrypted. So whenever I want to know that patient, I should have that key to open and see the whole information. So this is just a simple way. Now, who's using blockchain in healthcare? These are some definitions we found. That all the information I'm providing is already referenced, so it's not basically an experience from UAE, it's being globally. The trailblazers, 47% of them basically we call them the innovators, the first thing that comes in the market, the first mobile, they go and buy it. The first TV, they go and buy it. The first car, they go and buy it. So 47% of those population, they are interested, and they just popped into blockchain to see what is blockchain healthcare. 29% followers, 70% expecting great benefits, and so on. This is just few percent to show you how blockchain healthcare is really interesting. Now, global blockchain healthcare market, high, mid, low. You can see the green area in this, and we are in the low area still. In the blockchain conference, which I was in Armenia, one of the slides was showing that there is a great shift in the next 10 to 20 years. There's going to be great shift for blockchain from high zone to low zone. And this was documented by them, that saying that the technology-wise being really interested to move from those countries to here for many reasons. Now, what challenges are facing us by regulations here? I'm talking about from regulation background as well. Authenticity of the healthcare providers. Verification and credentialing. If a doctor submits his papers to be licensed, you need to verify his documents. If a patient will go to see a doctor, you need to verify that patient is the same as the ID. Population health management. Restrictions, malpractice. Like restrictions, for example, if I am in UAE, I want to travel to, let's say, Saudi Arabia. Today, I can't expose my information to a doctor in Saudi Arabia because I don't have any tool which can I open my mobile, show the doctor all my results. I still have to take the permission to take my medical file from Dubai or write a medical report, maybe take a picture of it, show the doctor. But what if I have a blockchain which is connected between two countries? The moment I'm there, the doctor will log into the system and see all my records, with my permission, of course. Malpractice, medical device regulation, data security, data sharing, data management. All of these are really challenges which is facing in regulation when you talk about blockchain. But still yet, there are many, many, many opportunities, as I mentioned, in healthcare and blockchain. Data security is one of them. Actually, the data security will be much more improved if you use blockchain. You don't need any more to take, let's say, for example, I go and I want to show my medical report to a doctor. After all, I can still apply for my medical report, take a scan, send it to my friend, who will send it to his doctor friend, who will show it to another doctor, so the security is already breached. I'm not preserving the patient rights, actually. I'm just saying that it's being secured. But in blockchain, is another way. It's a key. You can't see the information unless you have that key. Transparency. It's very important that all the information which I need to expose, some patients, for example, they say the doctor that, are you diabetic? No. Do you smoke? No. What's your problem? I have chest pain. Have you ever been taking any medication? No. I'm perfect. this is my first visit. But with blockchain, you can see the full history of the patient because it's very crucial to know his history. And believe it or not, some patients, they do hide some information for many reasons. Long-term cost efficiency. They say, yes, blockchain is expensive today, but it will save a lot of money in the future. Reduce transaction time. Today, if a doctor wants to get a license in Dubai, if he applies in Abu Dhabi, it will take him again another 3 to 4 months or vice versa. Why? Because he has to apply from beginning. But what if we have a blockchain that all the information, basic information of the doctor, like his passport copy, his degrees, his experience, already in the system. The moment he applies in the other city, with that key, I will take all those information and it's going to be really quick and fast. Patient-generated data. We should not forget about research and education. How can we develop the country? How can we know the disease of prevalence in our city if we don't have this data secured and fast? So I'll show you some use cases. One of them is EHR, electronic health records. It's been really beneficial nowadays that they are using blockchain, and some of the countries, they started to use them heavily actually, invested in heavily in them. Basically, all this information will go into the blockchain, will provide all the information, will provide the accuracy and transparency. These are few things. Securing patient data. Location, Colorado. Platform includes completed and up-to-date information about patients. These are few examples which happen in the US to secure the patient data. Also, access to accurate database. Another example. I'm not going to go to the details, to be honest, because these are you can Google them, you can see them in the references, but I'm showing you evidence that it has been used, it's been active, and it's been really beneficial. Also, they use the drug and medical device chain. It's crucial important today that we know about the drugs and medications. We've seen in the news lately that this medication, for example, Zantac, was withdrawn from the oil markets. But how do you implement as a regulator? Basically, what we do, we send the circular to all hospitals and clinics not to use it. But we're still forgetting the patients who do have this medication at home. Maybe they're not following the news. Maybe the next appointment to see the doctor is after 3 months. What about those patients? With blockchain, it's easy. If I have this blockchain, even in my mobile, I can access all the information come to me that this has been blocked, no more to be used. Definitely, I'm going to be more aware about those advancements. And as I mentioned, the regulatory and credentialing process, if I have a system which is linked to all regulator authorities in UAE, for one of the examples, that doctor licensing is going to be easy and fast. Other uses of blockchain is consent management, research and clinical trial, making micropayments. I don't know what is micropayments, but it's mentioned here. Smart contracts, insurance, breakthrough in genomics, and so on. But basically, the message is very clear that blockchain will definitely reduce time and will be cost effective. This is a small video how to show what things we are doing in Healthcare City, and I will conclude with this slide. I think I should press again. Thank you very much.